What is panic disorder? Men and women with panic attack disorder have unexpected and also repetitive strikes of anxiety that last for a number of minutes. Occasionally signs may continue longer. These are termed panic attacks. Panic attacks are identified by a worry of disaster or of completely freaking out, and even when there is no actual danger, a person may likewise have a powerful physical response during a panic attack. It might seem like having a coronary. Panic attacks can surely occur at any moment, and many people with panic disorder worry about as well as dread the possibility of having one more attack. An individual with panic disorder may become depressed as well as really feel self-conscious due to the fact that he or she cannot carry out normal routines like going to the grocery store or driving. Having panic disorder can additionally disrupt academics or employment. Panic disorder often begins in the late teens or very early adulthood. A lot more women than men have panic disorder. However, not everyone that experiences panic attacks will produce panic disorder. What are the symptoms and signs of panic disorder? People with PD might have sudden and also repeated assaults of worry, a perception of being out of control during a panic attack, an intense worry about when the next attack will certainly happen, a concern or evasion of locations where panic attacks have actually taken place before, physical signs and symptoms during an attack, such as a heavy beating or racing heart, sweating, breathing issues, muscle fatigue or wooziness, really feeling warm or a freezing chill, tingly or numb hands, chest pain, or stomach discomfort. What causes PD? Panic is sometimes found to be hereditary in families, yet nobody knows for sure why some people have it, while others do not. Researchers have identified that numerous parts of the brain are associated with concern and anxiety. By discovering more about concern and anxiety in the mind, scientists may likely be able to develop much better treatment methods. Clinicians are likewise trying to find ways in where stress and also environmental variables may play a role. How is PD treated? First, talk to your physician regarding your signs. Your doctor must do a test to make certain that a different physical problem isn't creating the symptoms. The medical professional might refer you to a mental health specialist. Panic disorder is usually treated with counseling, pharmaceuticals, or both. Psychotherapy. A type of psychiatric therapy called cognitive behavior therapy is especially valuable for dealing with panic disorder. It teaches a person varied point of views, behaving, as well as reacting to situations that aid him or her feeling much less nervous and afraid. Medication. Doctors also might prescribe prescription drugs to help address panic disorder. The most typically prescribed medications for panic disorder are anti-anxiety drugs and antidepressants. Anti-anxiety medications are potent, and also there are different types. Many kinds start working quickly, but they typically must not be taken for extended periods. Antidepressants are used to relieve despondency, however they also are practical for panic disorder. They might take multiple weeks to start doing the trick. A few of these medicines might possibly cause side effects such as migraine, nausea or vomiting, or problem sleeping. These negative effects are typically not a problem for the majority of people, particularly if the dose starts reduced and is strengthened gradually in time. Talk with your physician regarding any kind of adverse effects you might have. It is essential to recognize that although antidepressants can be risk-free and also efficient for lots of people, they may be risky for some, specifically youngsters, teenagers, as well as young adults. A black box, the most significant type of alerting that a prescription medication can have, has actually been put on the labels of antidepressant medications. These labels advise users that antidepressants can create some people to have self-destructive ideas or make self-destruction attempts. Any individual taking antidepressants should really be kept track of intently, especially when they initially commence treatment with medicines. Do you occasionally have unexpected assaults of worry that last for numerous minutes? Do you feel like you are having a cardiac arrest or cannot take a breath? Do these attacks happen at unpredictable times, creating you to stress over the possibility of having one more at any time? If so, you might have a sort of anxiety condition called panic disorder. Panic disorder. When anxiety overwhelms, one more sort of medicine called beta blockers can help regulate several of the physical symptoms of panic disorder, such as too much sweating, a battering heart, or dizziness. Although beta blockers are not commonly suggested, they may be useful in certain scenarios that induce a panic attack. Some people do better with cognitive behavior modification, while others do better with drug. Still others do best with a mix of the two. Talk with your physician regarding the most effective treatment for you.